It started out like a totally normal day.
Mom!
Okay, move objection deadline to the third line after survey. Oh, honey, for when you write, always use the verb start. What are you doing down there? Did you finish your breakfast?
Ow.
Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her shoes. Nobody move. I'm getting a dustpan. Whoa.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Welcome, everyone, to today's American Heart Association's Women's Heart Health webinar sponsored by Ascension. I'm West Michigan Executive Director Jana Saminsky. In 2004, the American Heart Association launched our Go Red for Women movement. It's a movement dedicated to raising awareness and fighting a women's greatest health threat, cardiovascular disease. Cardiovascular disease remains the #1 killer of women. And as we prepare to celebrate 20 years of Go Red for Women in 2024, we're more focused than ever on removing the unique barriers women face to experiencing better health and well-being. Here are the facts. 44% of women over the age of 20 are living with some form of cardiovascular disease. Only 44% of women are aware that cardiovascular disease is their leading cause of death. And less than half of women entering pregnancy are in optimal cardiovascular health. What's more, only 42% of cardiologists report feeling adequately prepared to assess cardiovascular disease specific to women. These startling statistics are why we're here today. And as we look at the state of women's heart health, we realize we must take action to continue to make an impact and save women's lives. A 2022 presidential advisory, Call to Action for Cardiovascular Disease in Women, Epidemiology, Awareness, Access and Delivery of Equitable Healthcare, speaks to the startling needs that still exist when it comes to the care, treatment, and prevention of heart disease in women. In today's webinar, we'll explore what makes women more susceptible to heart disease, how risk factors are different between women and men, and how we can recognize the signs and symptoms of heart disease and stroke. We'll hear from some women who have fought these conditions and survived. and learn how to combat stress and other risk factors and be proactive about our heart health. During today's webinar, a representative from the American Heart Association will be monitoring the chat for any questions or comments that you may have, or to connect you with additional resources. It's never been more important than it is now for all of us to take action that could save our lives. So let's get started.
Every year, more women have strokes than men.
Did you know that heart disease is the #1 killer of women?
Women, especially Black and Hispanic women, are disproportionately impacted by heart disease and stroke. Without the research and the breakthroughs of the American Heart Association, I would not be here.
Hi, I'm Carrie Hamilton, and I'm a survivor. I was running around. I was, working. Things were a little bit more stressful than usual. I was having to deal with some family matters of, cleaning out homes. October 6th of 2009, I woke up in the morning twice with some chest pressure. Half asleep, rolled over, the pain went away, go back to sleep. Got up, went about my day, did all my errands, sat down for a late dinner about 9 o'clock, and the chest pressure came back. And it wouldn't go away. There was no amount of wiggling around or getting comfortable or whatever that it would go away. So after about 10 minutes, I told my husband, I said, well, we need to go take a little drive. We drove to the hospital. I was instantly devastated and in tears. So I was in the hospital for about a week. I had to miss my 20th class reunion. It was a difficult recovery. I mean, it was shocking. They discharged me with a stress-induced heart attack. They looked at my scans and they called me up and said, you have had a SCAD, which in layman's terms means spontaneously the interior layer of my artery rips apart and it creates a tissue flap, and for me that tissue flap created a blockage. Fast forward to May of 2011, my grandmother had just passed away. There was some family drama at her funeral. It was a tough, horrible week. Strike of midnight, my husband's birthday, I went and had another heart attack. I ultimately flatlined in the cath lab, so they had to do CPR. And then I was rushed into emergency double bypass surgery. I was put in a coma for a week. I was emotionally numb for 18 months before I started to thaw out and could start to deal with everything that had happened. Shock, disbelief, devastation, fear. It was just a very tough, long recovery. Come on. And then we turned my dog into a service animal.
That's my Sandy girl.
Sandy became a lifeline. My extremely supportive husband was another lifeline. My heart sisters were another lifeline. Finding people to talk to who have been there is key. It's great to say, you know what, I'm having a crappy day. I'm not feeling well. My heart's doing all this weird stuff. And they're like, I know, I was like that yesterday. To have somebody who has walked that journey ahead of you, to be there, I can go to the hospital room and hold their hands while they're waiting to have their test, or they've had their test, or they've had their heart attack or event or their surgery or whatever. And it's so much more comforting, and your stress hormones come down, you just relax, and they are what gets me through. They are what I can remind myself on those low days. I can do stairs. I have gone and I have walked up the Arc de Triomphe. I have climbed on the Great Wall of China when there are signs that say if you have heart or brain disease, stay off. Raising money is huge because research doesn't get done without money. Research has enabled me to have a better quality of life. I can now lift my dog that's Velcro to me. She's 14 pounds. I'm grateful to the American Heart Association because they offer an opportunity for research, support, and awareness. I'm Carrie Hamilton, and that's my story.
women, their most common symptom is chest pain or discomfort, but they also can have other symptoms such as shortness of breath, nausea, vomiting, or jaw pain. Other things that they could experience would be headaches. They may have chest discomfort located in the mid area of their chest. It could be involving their one or both of their arms. They could have shortness of breath. They may have some pain in their back or their neck, sometimes in their stomach. And occasionally we'll see them with breaking out in a cold sweat, nausea, or lightheadedness. Women are notorious for not really seeking out medical attention when something like this happens. They'll sometimes get like jaw pain or think that it's indigestion, and they're kind of used to maybe having some indigestion or something, so they don't really correlate it with it being their heart. The symptoms can sometimes come and go, and if they get worse with activity or anything like that, we need to be concerned. If they don't relieve once they sit down and rest, that is a concern. Also, we would highly encourage them to get that checked out. They should see their doctor. An EKG could be done. They would probably order other tests, such as an echocardiogram or a nuclear stress test, maybe a cardiac CTA, to see if there's cardiac involvement with this. Really important that they follow up with any symptoms they may be experiencing. For a stroke, they may feel a sudden numbness or weakness of the face or arm or leg on one side of the body. They could be experiencing some confusion, trouble speaking or understanding. They may have some vision problems, difficulty walking or dizziness, loss of balance, maybe a severe headache. Those are some symptoms that show up for both men and women.
Heart disease is the #1 killer of men and women in the United States, but that's where the similarities end. Men and women present with different symptoms. Ladies, would you know if you were experiencing a heart attack, or would you just chalk it up to stress? Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Heart disease and the differences between men and women is the focus of today's show. But first, in today's headlines, traditionally, heart disease risk is calculated based on factors such as type 2 diabetes, blood pressure, cholesterol, family history, smoking status, physical activity level, diet, and weight. Missing from these formulas are female-specific factors like pregnancy, miscarriage, preterm delivery, gestational diabetes, or preeclampsia, which is dangerously high blood pressure that develops late in pregnancy. Other factors to consider are menstrual cycle history, types of birth control, hormone replacement therapy, and polycystic ovarian syndrome. Those are a lot of extra factors to consider when diagnosing and treating women for heart disease, but they're really important factors to be considered. The bottom line is more research is needed to fill in the knowledge gaps about women's risk factors. In the meantime, keep an open line of communication with your healthcare provider to determine your own personal risk. So men and women experience different heart attack symptoms. Let's go through the list. Here are some common symptoms for men to look for: squeezing chest pressure or pain, jaw, neck, or back pain, nausea or vomiting, shortness of breath. Women have a longer list of symptoms: chest pain, but not always, pain or pressure in the lower chest or upper abdomen, jaw, neck, or upper back pain, nausea or vomiting, shortness of breath, fainting, indigestion, extreme fatigue. It is unfortunately true that women tend to dismiss their symptoms. Why? Maybe it's not as commonly known that heart disease is the #1 cause of death in women. Women, pay attention to your symptoms. You take care of everyone else in your family. It's time to take care of yourself too. Regardless of gender differences, if you're experiencing any of the symptoms that I listed, call 911 immediately. Do not drive yourself to the hospital. Try to stay as calm as possible while waiting for help to arrive by taking deep, slow breaths. So some key takeaways. Heart disease is the #1 cause of death for both men and women. Women's and men's symptoms can be different. Do not dismiss your symptoms. Call 911 immediately. If you have questions about health conditions, I would love to hear from you. Join me here next time for Answers You Can Trust.
When I was 14 years old, I was trying to put my favorite shirt on, and I realized I couldn't put it on, and my ears got warm, and my vision started to go. And a second later, I found myself on the ground. We get to the hospital, and it felt like an elephant was sitting on my chest. A little bit afterwards, the doctor comes in and he's like, "Yeah, I just want to let you know you have teenage anxiety." I woke up after the surgery and she said, "You had a heart attack." I didn't know what that even meant. I didn't know what heart attack meant. Seven years later, it was the summer of 2020, and I started to feel my quality of life really diminishing. I knew something was wrong. They told me 2 weeks then before my wedding that I needed open heart surgery, and I really realized at that point that they do not prepare you mentally of what you're going to be going through. I felt still embarrassed that I was struggling mentally. I got the surgery done, and they said the surgery was a success. I want people to feel comfortable in any stage of their life, understanding that all of these feelings are so valid. As women, we have to start prioritizing our health more, and not just our physical health, but our mental well-being too. I'm joining forces with the American Heart Association and using my voice through Go Red for Women to raise awareness. If my journey can help just one woman, then mission accomplished.
I started my morning with an ongoing migraine, which I had for a couple of days, but I was also throwing up. I was throwing up quite a lot.
Throughout the day, I had fatigue or just tiredness. Definitely didn't know what was going on. I was having a lot of tingling and weakness in my arms.
I was experiencing numbness, tingling, lots of shooting pains throughout my left arm. It was very hard to detect what exactly was wrong with me. I had no idea that it would actually be anything remotely close to a stroke.
I went to my porch, the phone rung. It's my sister. I answered the phone, the FaceTime. She says, "Hey, how are you doing today?" I said, "I've been tired all day." I was like, "What's up? Talk to your niece, you know, Naomi really wants to talk to you." I got on the phone with Naomi, we're FaceTiming. She was like, "Hey, TT," you know, we were going back and forth. And then she says to me, and I recalled, "Why are you making those faces at me?" My sister at that point, she started asking me questions. She saw that I was having a stroke possibly. So she went through the whole fast. And if it wasn't for my niece wanting to speak to me, the nurses and the doctors were saying, I probably wouldn't have made it.
I started to step out of my bed and I slipped out of the corner and fell to the floor. My daughter called 911. When they took me to the hospital, they thought their mom's not coming back. I had 20% chance of making it. Stroke kills more women than men. It's really all about the timing. You have to act quickly in these situations.
I am a survivor of a TIA, also known as a mini stroke.
I kept experiencing mini strokes, and I was diagnosed with moyamoya disease, which is a cerebrovascular disease. I found out that I needed what they call a cerebral bypass in order to just really extend my life. It took me about 2 to 3 months to relearn how to walk, to relearn how to kind of just talk and function again, because I did have a couple of cognitive impairments from it.
I've just been grateful to be alive and grateful for my family and for my friends and for my community.
I know that I'm mentally stronger than I was yesterday.
I'm fiercer now than I was before. Be aware of what is going on with your body at any time. To not ignore the signs or the symptoms, and don't be afraid to be fierce with your voice.
Cardiovascular disease is the #1 killer in new moms.
Cardiovascular disease can pose a threat to a woman's heart health during pregnancy and later in life.
If you're thinking about getting pregnant, talk to your doctor about your risk factors and how pregnancy can impact your health.
Losing one woman to heart disease is one too many.
At the age of 29, after giving birth to my second son, my blood pressure spiked tremendously. When they did the echocardiogram, they noticed that my heart was enlarged and that my heart function was in heart failure. They called it postpartum cardiomyopathy with hypertension.
48 hours after I just delivered, I felt like I could not hold my head up. My speech was slurring. I felt this sensation all over my body, like my body was on fire. It was very surreal, the moment that I experienced and what I now know was a stroke.
About 3 weeks after that diagnosis, my mother died of congestive heart failure, and I really didn't know what congestive heart failure was. So after she died from congestive heart failure, I let my doctor know. He told me that I probably had the same thing that she had, and during the pregnancy, the baby put a lot of stress on my heart, and I probably had undiagnosed hypertension.
In my 3rd trimester, I was diagnosed with preeclampsia. And I will admit, when that happened, I was devastated because I did everything I thought I could possibly do to put myself in the best situation. I haven't ever experienced high blood pressure, so I was just like, what do you mean? Like, I feel fine.
I want to be around for my boys because that's important to me. After I found out about my condition and the family history, we really changed the way we eat, and we changed the way we exercise as well.
I think if it wasn't for my son, sometimes I might have given up. It was so hard to walk again. It was so hard to move again. We kind of like grew up together. Like, we learned how to walk at the same time. We learned how to talk at the same time. Every woman wants to take care of everyone around her. She wants to nurture everyone around her. She wants to be the biggest supporter of everyone around her, to the point where you exhaust yourself, you give all of yourself, and you don't realize in order to continue to be that person and to help everyone you want to help, you have to be the best person you can be yourself first.
They do tend to have a lot on their plate. They have many different roles in their lives. They're so used to taking care of everyone else that usually they're the last ones to be taken care of. A lot of the time, stress can lead to unhealthy habits, sometimes such as overeating, non-physical activity, smoking, excessive use of alcohol. All that it can be forms of how they are trying to relieve stress in their lives. It's really important that they speak with their provider about the stress in their life and how it impacts their health. They need to make time to unwind. They need to try to do activities that they enjoy, such as connecting with a community or maybe faith-based organizations. Get in touch online through social media, maybe by phone or mail. Find a community to be involved in. They need to take care of themselves, such as eating a healthy, balanced meal, regular exercise. We recommend 30 minutes of exercise a day.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
Women's heart health is extremely important, and it has not gotten as much attention as it should, and we should appreciate all the efforts that AHA has taken in this direction for all these years. Heart disease is the #1 killer for women in the United States. It's a bigger killer than breast cancer. It's a bigger killer than all cancers combined. And if you look into the problem, why we have not been able to address it, there are two major issues. One is getting that awareness out to the patients to be able to recognize their symptoms and get medical attention. And second, to get our physicians on board to be able to recognize and treat women the way they deserve to be treated with individualized attention to their risk factors. To give an example, I'm an interventional cardiologist. So I mainly see women. I'll see a lot of women who have heart attack. The problem is if you see a woman with heart attack and a man with heart attack, we have, in either case, only 90 minutes to save that heart from the time the symptoms start. So time is critical. And one of the key pieces about a patient getting that chest pain and getting that artery opened up within 90 minutes, the most important piece is the patient recognizing their symptoms and coming to the hospital. Once that 90 minutes is over, the ability to save that heart decreases significantly. That is why it's important for women to understand what their symptoms and signs of heart attack look like. They have to understand it's not going to be a Hollywood heart attack that goes to the chest, goes to the jaw, goes to the arm. They could just feel dizzy. They could feel lightheaded. They could feel short of breath. They could just feel nauseous. So that awareness is absolutely critical. Research is the groundwork to get things done in the clinical world. If you look at the research that was done years ago, before everything, all of these efforts started by AHA, thanks to them, is that there was almost 80-90% of the participants were men, and women were only 10%. And when we look at that patient population and we say, okay, this drug works or this drug does not work, it is based upon the patients who were as a part of that trial, which basically means that if women were only 5 to 10%, we really don't know if those drugs work in the women. We don't know if those procedures work in the women. Hence, doing trials that represent women is very important to understand what works and what does not work. And that is what translates into treating women correctly and with evidence-based medicine. No matter how much efforts we take as medical organization, ultimately the responsibility is on the shoulders of our patients and their family. And I want to involve the members of the family. I want to involve the father, the brother, the husband, the son to come forward and push their family members, their female family members, to get checked, to get treated, and make sure they are put in the forefront because they spent all their lives putting the rest of the people in the family at forefront.
Thank you, Dr. Serene, and to Ascension for your support of Go Red for Women and the American Heart Association. Our generous sponsors like you help make the advancements we're making with life-saving research and the ability to raise awareness possible. Let's face it, cardiovascular disease causes 1 in 3 deaths each year. It's a third of our mothers, sisters, friends, neighbors, co-workers, and other loved ones. And 1 death is too many. Today, we learned cardiovascular disease impacts some women at higher rates than others. But the truth is, most cardiovascular disease can still be prevented with education and healthy lifestyle changes. As we look ahead to our 20-year anniversary of the Go Red for Women movement in 2024 and the American Heart Association Centennial Celebration, we recognize the progress we've made in 100 years. The American Heart Association and dedicated researchers and volunteers have made bold moves resulting in significant medical advancements. The first artificial heart valve, implantable pacemakers, cholesterol-lowering medications, techniques for CPR, and so much more. As we move into our 2nd century, we share a focus on cardiovascular health for everyone, everywhere. United with more than 35 million volunteers and supporters, working as a global force, in our next 100 years, we will transform the way the world understands, treats, and prevents cardiovascular disease and stroke. By understanding the various factors affecting women's heart health and addressing the gaps in knowledge and care, we can fundamentally achieve health equity for women. To learn more about how we're working to address health equity in women and how you can play a role, visit goredforwomen.org. For information on how you can help us make an impact in West Michigan, visit heart.org/Michigan. Thank you all for joining us today. Making your health and the health of your loved ones a priority. Remember, your health is in your hands.
What would I do if I had more time?
Wow. If I had more time, I'd call my grandma back. I miss her. I'd go straight to the studio and dance my little heart out. I would take up the guitar again because I have always wanted to be a rock star.
I would love to spend more time laughing.
I'd empower women to move.
I would do more of what I want to do and less of what I have to do.
If I had more time, I'd give it all to her.
If I had more time.
If I had more time.
If I had more time.
In 2008, at the age of 37, I suffered a heart attack. And I never saw it coming.
At 10, I was diagnosed with dilated cardiomyopathy. And at 22, I had a heart transplant.
Thanks to research funded by the American Heart Association,
so many of us have been given more time.
More time with our families, more time with our dreams, and more time to accomplish the things that cardiovascular disease tried to take from us.
And we're not going anywhere.